Aisha.
Hi, everybody. Questions in chat. I think I'm done about Costa Rica. It's interesting. I find that if you go to CDC page, it says very high risk country. They have one of the lowest current transmission rates. So I'm not exactly sure how CDC is defining the high risk countries. And I find it quite fascinating the level of degree of adherence to masking and like just the basic sense precautions. It's pretty remarkable. It's just like they're just living their life masking themselves wherever they go. And so they're looking kind of funny at the Americans who are walking without the masks. And but they're not saying anything. And it's very easy and comfortable environment. Nobody says anything and sort of just a routine. So yeah, that was my point. Okay, so updates. Those of you who have seen this crazy study that I'm about to put in the chat, feel free to ask me questions. I'm trying to figure out translation of this to the real practice. I have looked, the company that I have been using to have my patients get CBDA sent me the records for 10 patients that have been taking it. None of them had COVID. Now, I don't know what that means. We need to look at much larger data set, but it's an interesting idea, possibility. If you're taking CBDA or CBGA for any particular reason, please message me privately, personally, at some point, because we need to try to get more data points and decide what to do with this, if anything. I'm sure there's an industry that's trying to figure this one out. I don't know whose misinformation. This is National Academies of Science journal. This was peer-reviewed. This is fully published. I looked at the methods. They're extremely well done. The suppression of entry is nearly 100%. At the high doses, it's complete blocking of viral entry into the cell. I tried to compare that to some other things, including medications. I have not seen anything like this. And that's what authors also stated. They stated that current medications on the market and anything else that ever been tested has way weaker impact. So the question here is, how is this translates to the human beings? It's your guess against my guess. I tried to translate the dosing from Petri dishes to, I don't know if I can do that. I mean, that's a point why we have first animal studies after this and then human studies, but everything's is on an accelerated timeline. So hard to say. But there definitely should be enough patients out in the country taking CBDA, and doing a formal analysis of those patients versus those who don't could be potentially not that difficult of a task. So stay tuned for more. If you take it for pain, as we discussed, CBDA is a very good Motrin-like substitution for chronic arthritic pain at the high doses of 50 to 100 milligrams a day. So if you're already taking it, by all means, continue. I don't know if it's worth starting taking just for the prophylaxis, because the cost is going to be at least $100 a month. It's pretty pricey. So I wouldn't do that if I were you. But if you're already taking it and it helps your pain, then yes, definitely continue. That's the message here. Okay, questions into the chat. I'm not seeing any. So if there isn't any, we can move to Reza. If nobody, today is a quiet group.
Well, it's not gonna be too quiet. I have 3 little kids, so they might come and run around. I'm trying to tame them, back from here as much as I can. But if you hear any screaming, I'm sorry. I think they're upstairs right now. We're okay.
All right, looks like there are a couple of questions. So let's take care of those first. Kathy is asking am I talking about more COVID pills at the beginning? Is it worth trying to get some? No, right, that's a good question. That's not very clear. I don't know that it's easy to get those pills actually right now. I think my understanding that they're often used for high-risk patients. I have not prescribed a single one, so I don't know what to say. I'm pretty sure that no doctor at this point will be willing to write you a prescription just so you have them at home. because that you can imagine what that's going to generate. If everybody's going to start hurting the pills, they're going to run out immediately, because the amount of doses, I'm sure, is still limited. So don't think about it. The whole point here would be to give them to certain types of patients at the high risk in a scenario when you already have a COVID and you reached to your doctor. The latest, okay, next question is, what do you think of the latest study that gave scientists, doctors a better indication of who contact COVID? I probably have not seen it, so I'm not sure. Maybe you can put that in a chat for me for the next week. I guess that's one option. So yeah. Okay, do I agree about restrictions? No, I don't completely. That sounds a bit too optimistic. What next variant? We have the Omicron still here, and it's decreasing, but in some parts of the country it's increasing. So I think lifting restrictions and then having another spike of Omicron right now, I think what I learned in Costa Rica is simple. You don't need any particular, you just create the ongoing standard of basic precautions and stick to it and live your normal life. That's exactly what their life looked like. They're allowing big gatherings. They're just maintaining distances and then only doing gatherings in a safe environment. So like when we were in this large auditorium, they had a special fence set up and they were positioning everybody 20 feet apart. Like they had this massive building that looks like a convention center that probably can sit 20,000 people easy. And they only had about 500 in there, in that whole room. So it looked a little weird, like everybody's sitting really far apart, and they're sticking to it. I mean, they're like maintaining that. So I think we're in a sense overthinking this whole and kind of overly scared and frankly too divided. I have not seen that division over there. It was pretty uniform. That's all part of life and we're fine with that. We're just living. Pura vida, that's it. They're all answer for everything. It looks a little weird. Yeah, pura vida. I think we can learn from them quite a lot. Okay, I got the, that's not the study, that's a CNBC report. I'll need to get, I don't trust any of this, by the way, only the original studies. So well, I'll have to look at that. New research was published by Imperial College London suggesting that people with a higher level of T cells from common cold were less likely. Yeah, I've seen that study. Yes, that's what I assumed from the beginning. Those of you who have heard me talk about interferon boosting attempts, that's exactly the same principle. So your T cells are stimulated by interferon. Well, they're stimulated by multiple things. It's one of them. Completely agree with that. So key question is, should we not be afraid of common viruses like common colds? And that, I think that's part the lesson here. We've lived with the viruses go through the years for a long time. They do something to our immune system. The fact that they could be sort of protective makes immunologic sense, at least. So yeah. Okay, El, I think I'm gonna, again, I want to read this study because if this is correct, what you're posting in there, I need to learn more about it. So yeah, lockdown was not very effective. We agree with that. Well, one point was maybe the lockdown wasn't really a lockdown. You know, we weren't really very good at that. Other option is that simply lockdown could have been partially effective. We just don't think of the effectiveness in the right terms. You know, we know that we're not going to stop the virus. The point is how to protect the vulnerable and still live the life normally. And that's, in deep way, I feel we haven't fully figured that one out. And it's not necessarily a political issue. It's an issue that the science is lagging, not lacking, lagging. So, all right. And I'm at minute 15 with that. Gonna pass it on to our favorite, Reza, if you don't mind.
I appreciate that. All right, thank you, Misha. Appreciate it. So today, I was thinking about what to mainly focus on. And obviously chiropractic care, you know, I'm a chiropractor, so chiropractic care is the main focus, but I'm going to see how I can venture off to something sort of common that I feel like everybody wants to know about from a perspective that maybe some people haven't thought about. And one is a common thing I hear is arthritis and disc bulge, you know, disc herniation, disc injuries. And I wanted to kind of say a few things regarding that and how we can incorporate that into a wellness perspective of ergonomics. And a lot of you guys, as you know, you sit in front of computers, just like right now, the laptop, you're looking down. If you have your cell phone, you're looking down, everybody's looking this way. And one of the main causes of arthritis is a joint that's in a bad position. So long-term soft tissue injury, things of that nature can cause pressure into the joints and over time cause degeneration. And that's a fancy word for arthritis. So if we can make sure we have good healthy posture, we have good ergonomics, and ergonomics is really a big factor because structure dictates function. If your structure is bad, if you're hunched over, then your shoulder's not going to go up. Your function is going to be low. You can't lift your neck up. And if your neck is in this manner, then every inch your head is forward, it adds 15 pounds into your back. You're carrying a 49-pound rucksack on your neck. And over time, your neck becomes arthritic. And there are other reasons for arthritis, but that's one of the main reasons these days because everybody has really bad range of motion, really bad posture. I see that a lot. And so a couple of things that I wanted to point out. Number one is that your top of the screen should be at eye level. Most people think the middle of the screen should be eye level. The top of the screen of your computer should be leveled with your eyes. You should be sitting in a manner of 90-degree angle where your elbow is not overly stretched, is 90 degrees to your side, and your wrist is straight, not on the table. Most people are on a table type like this, their wrist is cocked back. And that causes a lot of elbow injuries. If they type like this, it causes carpal tunnel, things of that nature that I see often. So ergonomics seems to be a big thing these days, whether you're picking up a box for a living, you're sitting as an Uber driver, sitting in front of computers, everybody doing something consistently, especially with computers these days, and cell phones seems to be a big one. And so I really want to focus there and if anybody has questions in regards to any sort of pain you're having, I can kind of address that as well. And so one thing I do want to mention is that most people think straight is actually the best way. Research has shown the more you lie down, is actually less pressure on your back. But obviously, you sit in front of a computer, you can't lie down. But what the ergonomists recommend is be at about 100 to 110 degrees. So you're sort of just leaning back. So because gravity goes straight down, if you're sitting completely straight, your last two vertebrae take the brunt of the weight of the entire spine. But if you lean back, gravity will go in an angle, so your chair will take the hit rather than your spine, your last two vertebrae. That's why everybody gets L4, L5 disc injuries. It's mainly because of that situation, because your last two vertebrae take the brunt of the weight of the entire spine. And in addition to that, we have to make sure we're arm length away from the computer. A lot of people getting these migraines, getting pressure behind the eyes, sensitivity to light, and that causes a lot of issues. And over time, people become stressed. And I can't tell you how much I hear doctors recommend saying, oh, you have pain, you're probably stressed. Well, everybody's sort of stressed to a certain level, right? But how come same person doing the same job, it doesn't have the same pain as you do, and you have the same amount of stresses, for example? It's because everybody loads it on their spine differently. So what happens, you get stressed, you tense up. When you tense up, your muscles tense, right? And muscles tense, they squeeze onto the disc, your nerves, everything just compresses, and you can have pinched nerve, for example, carpal tunnel, or actually thoracic outlet syndrome, where you have radiating tingling numbness into your hands. You can have groin pain, numbness in your legs. You can have low back injuries. Over time, the disc compresses, sciatic pain going down your leg. And these get kind of complicated overall. But so kneeling chairs, I think kneeling chairs are good to a certain extent, but realistically, the best avenue is to stand every 30 minutes, try to stretch a little bit. and doing some yoga moves throughout the day. So certain things like this, where you just grab your waist and you go stretch backwards and forwards, that if you do that every 30 minutes for 5 seconds, just do 5 of these real quick, will help open up your disc space in your neck, will help open up your disc space in your back. In fact, better than the kneeling chairs, I recommend getting a therapy ball, sitting on a therapy ball. The reason I like those, and it can even just be the dome of the therapy, but there are wobble balls. You can kind of, I forgot what's called, Wobble Cushion, I think, if you go on Amazon. It's air inside, you pump it with air. And what I like, and you can put it on a chair. So it's about this big, and you put it on a chair. It's almost like sitting on a therapy ball, one of those big, if you guys don't know what a therapy ball is, anybody doesn't know, it's kind of bouncy. And what I like about those is because when you sit on it, your spine goes up and down as you go, as you're moving, you answer phone, you're typing and stuff like that. So there's some force that goes into the ball, and the ball will compress back up into your spine, and your spine will become like an accordion. It goes up and down as you're just doing your minimal, work, whatever you're doing. And that will help regenerate your disc and add blood flow, synovial fluid, and toxins coming in and out. So it's really good for that. So I'm not sure what Swiss ball is, but basically it's just a big ball that has air in it. So it's not that complicated with that. So just Google that. You should be able to find it. Yep, there you go. She's holding one. That's a really good, that's like a wobble ball, I believe it's called, wobble chair. I'm sure she can, right there you go. So that, you put that underneath you, that's almost like having the therapy ball. And what I like about the ball itself, better than the chair, if you guys have the ability to get the whole ball, is because most people put their feet under their chair. And ergonomically, as soon as you put your feet 90 degrees or below 90 degrees, so it goes under your chair, all the pressure goes into your low back arches too much, and it causes disc injuries from a different standpoint. Mainly stenosis is what it causes. So degeneration in the back of the disc, the back of the spine. So what I like about the ball is you can't put your foot under it. So it's really cool where it makes you have good foot positioning. And on top of that, it makes your spine be straight. And what I like about it, causes this air and disc and fluid to go in. And in addition to that, it helps with the balancing aspect of you sort of being in a good posture, because as soon as you let go, you're falling off that wobble ball. So subconsciously builds your balance, your cerebellum portion of your brain, where it helps with balance. And that's almost like training your brain how to not only be balanced, but have good posture at the same time, subconsciously, so that if you're sitting on a chair, you're going somewhere, you're doing something else, you're at a different desk, you've already been trained this whole time sitting on a wobble board or a wobble ball, and therapy ball, and that will help you automatically be on good posture in different chairs and different things like that. So from that perspective, now I do want to mention a couple of things about disc injuries. Some of you may know and some may not, but there's 3-4 types of disc injury. There's a disc bulge, there's a disc herniation, and the disc herniation has 3 different types. There's a protrusion, extrusion, and sequester. What research has shown, I'll put it this way, I hear a lot of people coming in and saying, disc bulge, I have back pain, my doctor told me I have disc bulge. Well, actually, the leading expert in spinal biomechanics, Dr. Miguel, if anybody knows him, has said that a disc bulge is like having gray hairs and wrinkles on the inside. Everybody has it. Actually, 80% of the population walks around with a disc bulge and no back pain. And so one thing I want to kind of tell you guys out there is, just because you have disc bulge doesn't mean you have back pain. In fact, it probably is not because your pain is not because of the disc bulge. So with that said, we have to really find the real cause. So sometimes when doctors don't know an answer, they'll just be like, oh, that's because everybody has a disc bulge. So it's all easy to just be like, oh, there it is. It's a disc bulge, and everybody will take it because they can see it. So, but this herniation that will cause pain, because it's protrusion, extrusion, sequester. Where protrusion, there's the nucleus and there's propulsus on the outer layer. If the nucleus comes out, it pushes the disc out, it can hit a nerve. If the extrusion is when the the outer layer, the pulposus also tears, and so the materials in the disc actually coming out, oozing out, and it can hit against the nerve in your spine. And then there's sequester, where a portion of the disc falls down the canal. So you can have it in your neck, and it falls down and gets lodged in your low back. And so with that said, there's different ways of treating that. If you have sequester where it lodges down, falls down, that's surgery 100%. There's no going around it. If you have the first one, grade 1, which is protrusion, that's 90%, 80% chiropractic care, physical therapy, low combo action will fix that. And then extrusion is 50-50, depending on how bad it is. It's possible conservative method can fix that. It's possible not. It needs surgery. So that can go either way, because it can cause weakness and things of that nature as well. So I see a question here. So tell me, as I've said, okay. Heard this right now, low back pain. Would your lumbar support sitting on a chair be helpful? So we need to take an MRI to see what's going on, because sciatica by itself is a trash can diagnosis, because sciatica means that your sciatic nerve is being pinched. And the reason it's trash can diagnosis because it can get pinched at the low back. It can get pinched different areas of the low back. It can get pinched at the glute. It can be pinched towards the hamstring, towards the knee. So when you say sciatica, I don't know which one, at what point it's been pinched. So because each one point has a different whole treatment plan involved with it. So with that said, so we have to kind of figure that out. So if you're having sciatica, usually I will put it this way, just a rule of thumb, if it passes your knee, if you're shooting pain, if you have sciatica, and sciatica, make sure it's the back of the leg. A lot of people come to say sciatica and they have shooting pain in front of the leg. And that's not sciatica, they've been misdiagnosed. So if it's back of the leg and it passes your knee, you should take that extremely seriously, because that increases your chances of surgery. So that you need an MRI to figure out exactly protrusion, extrusion, sequester, and based on that, the right treatment plan for that kind of scenario. And so in addition to that, and then going back to arthritis, there's a couple of key points I do want to make about that, because it's really important, is that arthritis is like having gray hairs and wrinkles on the inside. This is, again, regards to Dr. Miguel, who's a leading spine expert internationally. And so most people have arthritis. A lot of people come to me and it's like, they've been diagnosed for their back pain. They'd be like, yeah, my doctor told me I have arthritis, that's why I have back pain. Well, everybody has arthritis. It's like saying I have gray hairs. At some age you will have arthritis. But I've had patients with terrible amount of arthritis with no pain at all, or very little, like tightness, stiffness. And I have patients where they have no arthritis at all, but they have extreme spine pain. So it can go either way. Arthritis is not a good diagnosis for the reason for your pain. It's again another trash can diagnosis, because everybody has arthritis. So if the doctor doesn't know the reason you have pain, it's easy to point at it and say, look, you have arthritis. So I do want to make that point there. So wobble cushions are pretty cheap too. Yeah, you can put it on your chair. It helps a lot. And that helps with regeneration of your spine. Because research has shown it doesn't matter if you're a triathlon before or after work, it's that 8 hours of sitting in front of a computer, that compression that happens on your disc is what really kills you. It doesn't matter if you're doing yoga 20 hours after work and before work. It's that 8 hours, 10 hours, you're sitting stressed out. So you really got to make it a clockwork thing where every 30 minutes you stand up, you stretch out, move, and that will kind of bring some blood flow to the brain. That will kind of refresh you. You'll think better, and you'll actually enjoy your job more. I have patients that they want to quit their job because they're in so much pain and agony and migraines. And so my office is called Metropolitan Headache and Spine Center. So migraines, headache is actually my specialty, neck injuries. And so I deal with that stuff a lot. And a lot of things I see with migraines, and people come say, I have sensitive to light, pressure behind the eyes. And they go to an eye doctor, they get all these MRIs for their brain, CAT scan, and there's nothing wrong with it. It's actually because they don't know certain muscles. For example, with the eye sensitivity, sternocleidomastoid muscle, SCM muscle, if anybody wants to type it in Google, referral pain of that SCM muscle does go right to the eye, and it causes these sensitivity issues, and it causes pain as well, and headaches, migraines. So, and to be honest with you, and I kind of use headaches and migraines kind of inclusively, where technically it's not, but I do it just because everybody sort of thinks about it in a manner. But realistically, headache is overall all headaches, and migraine is just a type of headache within that category of umbrella. Everybody, you know, I tell people, oh, you have headaches? You're like, no, I have a migraine. You know what? So that's why I don't argue with people anymore. I realize patients have thought certain things. And once I build their trust and they see that I fix them, then I kind of teach them, okay, you had this kind of headache. Migraine is just this and this. Because migraine is actually a chemical or hormonal reaction. If I was able to fix their migraines per se, I can't. It wasn't a chemical or hormonal reaction, because I don't fix chemical hormonal stuff. So glaucoma would come on the eye sensitivity after. Right. So I mean, I'm kind of simplifying it. It gets complicated. You have to examine. There's certain things like that. But to be honest with you, a simple way to figure out if it's outside of musculoskeletal. I mean, if I press here, this sternocleidomastoid muscle, and it goes to the eye, most likely it's a sternocleidomastoid. It's not glaucoma, for example, right? But if I press here and I can't find it, or like, okay, it doesn't exist, it's not shooting to the eye, then I would send for, you know, an eye doctor and, you know, kind of examine that, or do a brain test and stuff like that, and imaging. So then that helps with the overall healthcare system, because we're not running into CAT scans just because somebody's having the first migraine in their eye. So, you know, healthcare goes up, blah, blah, blah. So there's other impact on top of the fact that you just got a whole lot of radiation for your brain. So you don't want that. So if I could just pinch here and it goes to your eye, and I'm like, okay, there it is, and I fix it in one visit, then we just saved you radiation. We just saved the healthcare system, you know, all sorts of stuff. So it's beneficial across the board for everything, for everybody. And it's easy tests, just like a simple physical exam would tell us. So outside of that, I know I had about 15 or so minutes. I wanted to leave a couple minutes for questions if anybody wants to ask anything specific. Let's see. My hands-on manipulation. Okay, can you explain to me how chiropractic differ from osteopath? Have been their former not. Okay, so how does osteopathy differ than chiropractors? Here's the thing. There is a osteopathy and chiropractic. It goes back a little bit in history, but chiropractic care started from the concept of the nervous system. Osteopathy started from the concept of the vascular system. And what happened was that they were kind of doing the same thing. So I don't want to get into the politics of it, because it goes back, and that's how the fight is. Honestly, it's the same thing. There's really no difference. And it's just a political thing of saying, I don't do chiropractic adjustment, when in fact it's the same exact adjustment, same exact thing. But realistically speaking, I think from a perspective of training, chiropractors, this is what we do all the time, right? So from osteopathic medicine, they're more towards MDs now. So they take a few classes of adjustments, but or manipulation, osteopathic manipulation, as they like to call it. But for me as a chiropractor, I went to school after college for another 4 years of exclusively manipulation. So if you want to get a neck adjustment done, you want to go to someone that does it all the time. You want to go to a surgeon that has surgery all the time and has on a regular basis. You want to go to a surgeon that, you know, has surgery once a month, for example. So those are the things. So from a training perspective, for 4 years, chiropractors do more hands-on, hours-wise manipulation than osteopath. So I think from a quality perspective, chiropractic adjustment should be better than osteopathic adjustment, just because chiropractors have more training, have more hours of training in manipulation. But if an osteopath has the same amount of hours of training, they'll be just as good as a chiropractor. It's just a time thing. I don't think they have the same amount of hours as we do, just because they're also a physician from an allopathic sense. Let's see. Are your hands on it? So I think I did that. Palmer method versus other. So there are different variety of chiropractic adjustments within the chiropractic. You know, there's ways to do surgery. There are some people that believe in certain things. I've been to grand rounds where surgeons fight over which nuts and bolts they got to use, and they fight fiercely about saying which tool is best for that. But realistically, it comes down. It's about all the same. There's some. There's diversified. There's some other methods and stuff like that. They think they're more exclusive or more precise, but realistically speaking, what the research has shown is that it's all the same. It's all the same adjustments. As long as it's done well and you feel better, you got a good adjustment. You should do well. I think Misha.
And yeah, I think
into anybody.
Yeah, I think with that, even if everybody still have questions, maybe you can put them in the chat for Reza to answer later, because we absolutely want to move on to Catherine, my favorite mind-body practitioner who joins us on a regular basis. Thank you, Catherine, for being back. Thank you, Dr. Eftekhar. And Catherine, floor is all yours.
Thank you. I just want to make sure, can everyone hear me? I think my internet's kind of going in and out. Okay, I'm good. Okay. Thank you all for having me back. It's wonderful to be here. I did want to specify, while I do wish I was a registered massage therapist, I'm not. It's Reiki master teacher, but maybe that's on my to-do list one day to do. So today I just wanted to take you all through a few different exercises, again, to ultimately just help just bring us down. It's okay, Jeanette, it's okay. Just to help bring us down, bring us some calmness. But before we actually did that, we're gonna take a moment to just do a little bit of shaking. So I'm gonna stay seated so you're not staring at my stomach, but if you want to stand up, you can. Shaking is a wonderful practice that can really help if you're feeling any stress, tension. Sometimes with people who've experienced trauma, it can be really helpful. We see animals do it, right? When animals get scared or something happens, right? They'll kind of shake and then they'll walk it off. It's that same type of thing. So as humans, we don't do it. So we just absorb whatever may be going on. So if you want to take a moment, again, you can turn your video off if you want to, and you can just start shaking your hands, maybe have it move up into your whole arms. Maybe if you want to also bring this down into your legs, maybe getting your torso involved, and we'll just shake, maybe releasing anything. I just moved this week and I was moving a lot of stuff by myself because I moved within my building, and my body just feels very like I got some gunk on me. So just shaking it all out, shake out your week. Whenever you feel like you've done enough for you, I invite you to come back to a seated position, maybe make any stretches that you need in your neck and your shoulders. You can sigh it out. So whether you're seated, laying down, or reclined, I invite you to just come into a moment of stillness, a moment of pause. And notice how your body feels. Notice the effects of this very natural movement of shaking and what that feels like. And here I invite you to tap and tune into your breath. You can have your normal, natural breath, or if you would like to take a deep breath in and sigh it out. This can help to stimulate our vagus nerve, helping us to come to a place of deeper relaxation. And again, take a deep breath in, and if you choose to, you can sigh it out. And one more inhale. And either exhale or sigh it out through your mouth. And here I invite you to just focus on your breath. 1 minute, we'll just be breathing. Notice as you breathe, if you can feel it down into your belly. Notice as you breathe, if you can feel it in your lungs. Notice as you breathe, if there's any way that you can extend and lengthen your breath. So taking in more oxygen. And as you exhale, releasing every last drop of carbon dioxide of anything you no longer need. Our breath is always with us. It's an easy and best tool to tap into. We need to be a little more mindful, be a little more grounded. So wherever you are, as you continue to breathe, I invite you now to feel the connection between your body and the floor or a chair or whatever surface it is that you are resting on. Take a moment to notice each point that connects your body to all of the surfaces that are supporting you. And I invite you to begin to feel the heaviness as your body sinks and is resting in these surfaces. We'll do a practice to help just generate and focus on body awareness. So while your body is relaxed as it is, your mind is completely aware. I invite you here to bring awareness to your toes. I invite you to feel the toes on the right foot. Envision the toes attached to your left foot. Notice the left big toe, the fourth toe, third toe, second toe, pinky toe, the whole left foot, the heel, the sole of the left foot, ankle. Notice the whole left foot, whole left foot. Become aware of the right foot, the right big toe, fourth toe, third toe, second toe, pinky toe, the right foot, the heel, sole of the foot, ankle, the whole of the right foot, whole right foot. Become aware of both feet together. Draw your attention now to the left leg, the shin, calf muscle, knee, thigh, the left buttock, the whole of the left leg, the whole left leg, the right leg, shin, calf muscle, knee, the thigh, right buttock, the whole right leg, the whole right leg, both legs together. The hips, the lower back, the middle back, upper back, the whole back, whole back, the whole back. Notice left shoulder blade, right shoulder blade, left shoulder, left upper arm, left elbow, left lower arm, left wrist, left hand, right shoulder, right upper arm, right elbow, right lower arm, right wrist, right hand, both arms together. The chest, ribs, belly, the whole of the front body, the whole of the front body, the whole of the front body. The neck, back of the head, the forehead, left eyebrow, right eyebrow, space in between the eyebrows, the left eye, the right eye, left cheek, right cheek, the jaw, tongue, the lips, space in between the lips, inside of the mouth, chin, throat, the whole of the head, the whole of the head, the whole of the head, the whole of the body, the whole body together, whole body together. Feel the lightness of the whole body together. Give yourself permission to relax and feel heavy. Relax the whole body. Continue to breathe as your body is relaxed. I invite you to place one hand on your belly and one hand on your chest. Notice your chest rise and fall. Notice the belly rise and fall. Inhale, exhale. Continuing with your natural breath, feeling the air enter through your nostrils, exiting through your nostrils. Feel and notice your breath. Inhale, feel the belly rise, feel the ribs expand, the chest lift, coming to the top of the breath below the throat. As you exhale, the breath leaves the chest, the ribs fall and the belly contracts. I invite you to continue with this breath, feeling all three parts of the breath. Thinking to yourself, belly, ribs, upper chest, ribs, belly, belly, ribs, upper chest, ribs, belly, belly, ribs, upper chest, ribs, belly. After your next exhalation, I invite you to begin to feel the breath as a wave coming up from the belly and rising to the top of the breath beneath the throat. Hold this breath for 2 counts and allow the breath to go in a wave from the chest out to the belly. Continue with this wave-like breath rolling in and up, holding for 2 counts and rolling out like a tide. Feel the fluidity of your breath. Feel the complete cycle of your breath. Focus only on your breath. Allow it to roll in and up. Hold for 2 counts and allow it to roll out like a tide. I invite you to continue this type of breathing for 5 more rounds, breathing at your own pace. After your next and final exhalation, I invite you to return to your natural breath. Notice the quality of your breath. Find calmness in your breath. Find ease and steadiness. And taking one more deep breath in through your nose I invite you to exhale it out through your mouth. As you're ready, I invite you to begin to make any small stretches or gentle movements, starting in your fingers, your hands and wrists, your toes, feet, and ankles. And then moving to any other areas of the body that feel like they need a little loving movement. As you begin to come back together to our virtual space. If you're laying down, I invite you to return to a seated position. And wherever you are, I invite you to open your eyes when you are ready. Our practice is done.
Thank you, Catherine. That was very refreshing and needed,
Good.
especially in the time of the rain. Very, I don't know, I'm sure half of us fell asleep.
Thank you, thank you, thank you.
Well, thank
My anxiety levels have lowered.
Yay, good. That's the goal.
All right. Well, thank you,
Misha,
both of you. Yeah.
do you want to have Reza answer any more questions? Because he looks like he's still on with us. Or do we want to be peaceful?
I think we want to be peaceful, and I think everything was answered. I think he answered the Palmer method versus others, so I think we're good.
I'll just write my email in here.
Yeah, why don't you,
And if anybody
Reza,
wants
and
to
also
just jot it down and email me.
put the email and also put your website there too.
Oh, okay, yep, I'll do that.
And we'll just leave it there for a second for anybody who wants to. And you are taking your patients, correct?
Yes.
Good question, Misha.
Yes. It's a little bit of weight, but it's about 4 weeks, 4 to 5 weeks right now. Oh, I think I spelled my website wrong.
Reza, don't worry about it because I'll put it in the email that I'm gonna
Okay.
send out this evening.
Perfect. Yeah, I wrote
Yeah.
the answer wrong, but yeah, that's it.
Yeah, thank you.
Thank you, everybody. And stay warm. I think, unfortunately, we're going to drop the temperatures again. So I don't know if it's going to freeze out, but be careful. So, yeah.
Bye, everyone.
Okay. Bye, everybody.
Bye. Thank you all.
Yes.
Come to New Zealand. Right. We would love to.
Bye, family.
We would love to.
Bye, everyone.